name is
Look at the camera.
My name is Hugh, and today I'm going to talk about the coronavirus. This data by the World Health Organization was reported by February 12, 2020. Some highlights are that, fortunately, no new countries reported cases of this disease in the past 24 hours. The WHO has published key considerations for repatriation and quarantine of travelers in relation to this disease. More information can be found here.
So talk about this.
Globally, 45,171 confirmed cases have came. In China, 44,730 have been confirmed. 8,204 are severe cases and 1,114 deaths. Outside of China, there have been 441 confirmed cases. 24 countries have seen this disease and 1 death. The WHO risk assessment says that China risk is very high, the regional level is high, and the global level is high. This is a map of where the coronavirus is. The larger the circle, the more cases.
China obviously has a big.
And China has the biggest amount of cases.
This is how this disease travel internationally.
Excluding China, there are 24 countries reporting cases of the disease. Among the 24 countries, 23 report cases with an exposure in China.
That's enough. This is a table about different regions and cities.
This is a table about different regions and cities and
within
China and how many and their population, confirmed cases, the suspect cases, and all the deaths. Hubei has the most confirmed cases, suspect cases, and deaths.
Followed by
Guangdong, Zhejiang, and Henan. The lowest is in Xizang or Tibet, where there is only 1 confirmed case, no severe cases, no suspect cases, and no deaths.
Okay, this is by regions.
This is a table by countries and regions of where they have
Found cases.
Of where they have found cases of the coronavirus.
In the Western Pacific.
In the Western Pacific region, China has the most, followed by Singapore, Japan, and the Republic of Korea. In the Southeast Asia region, Thailand, India, Nepal, and Sri Lanka have found cases of the disease. In the region of the Americas, US has 13 and Canada has 7. In the European region, Germany has 16, the most, followed by France, the United Kingdom, and Italy.
Eastern Mediterranean.
In the Eastern Mediterranean region, 8 cases have been found. Besides that, the International Conveyance Japan have found 175 cases and 1 death.
This is cases identified on a cruise trip.
These are cases identified on a cruise ship currently in Japan in Japanese territorial waters.
These are an epidemic curve.
What?
This is an epidemic curve.
This is an epidemic curve of the disease cases identified outside of China by date of onset of symptoms and travel history.
This is an epidemic curve. This is another epidemic curve.
This third figure is another epidemic curve of the cases identified outside of China by date of reporting and travel history.
So the WHO has some strategic objectives.
The WHO has some strategic objectives for this response are to limit human-to-human transmission, including reducing secondary infections among close contacts and healthcare workers, preventing transmission, amplification events, and preventing further international spread from China. Identify, isolate, and care for patients early, including providing optimized care for infected patients. Identify reduced transmission from the animal source. Address crucial unknowns regarding clinical severity, extent of transmission and infection, treatment options, and accelerate the development of diagnostics, therapeutics, and vaccines. Communicate critical risk and event information to all communities and counter misinformation. Minimize social and economic impact through multi-sectoral partnerships.
So there are also some preparedness and response guidelines.
There's also some preparedness and response guidelines.
Most importantly, these are recommendations and advice for the public.
Most importantly, these are recommendations and advice for the public.
Just your support upon
avoiding close contact with people suffering from acute respiratory infections. Frequent hand washing, especially after direct contact with ill people or their environment. Avoiding unprotected contact with farm or wild animals. People with symptoms of acute respiratory infection should practice cough etiquette adequate, maintain distance, cover coughs and sneezes with disposable tissues or clothing, and wash hands. Finally, within healthcare facilities, enhance standard infection prevention and control practices in hospitals, especially in emergency departments.
Okay. Finally, WHO.
Finally, WHO does not recommend any specific health measures for travelers. In case of symptoms suggestive of respiratory illness, either during their or after travel, travelers are encouraged to seek medical attention and share their travel history with their health care provider.
That's all.
That's all.
Look at the camera. That's all I wanted to.
That's all. I want to talk about Today I want to talk about the coronavirus.
Thank you very much for watching.
Thank you very much for watching.